Welcome to the Deep Dive. Today we're tackling something really fascinating and maybe surprisingly impactful in healthcare.
Oh, yeah. What's that?
It's all about how we design and manage hospital systems, but specifically with, human capabilities and limitations baked right in.
Human factors.
Right,
Yes.
exactly. Think of it like the science behind making healthcare actually work better for everyone involved. Doctors, nurses, and especially you, the patient.
Definitely.
We've been digging through info from big players like JCI, iSQA, India's NABH too, and insights from places like Supremediq, plus various studies.
A good mix of sources there.
Yeah, trying to get to the heart of why this field, human factors engineering, is just so vital. Our mission, really, is to unpack how understanding the way we think, communicate, interact, how all that can lead to, dramatically safer and more effective healthcare.
It's so true. We hear a lot about the latest, medical tech or breakthroughs, and yeah, those are vital.
Of course.
But healthcare delivery, that comes down to people working within some pretty complex systems, and human factors engineering, or HFE, that gives us the framework, the tools to understand and really optimize those interactions between the person and the system.
So it's not just about when something goes wrong, pointing a finger.
Exactly not. It's about recognizing that errors often aren't just one person's fault. More often, they're a symptom of systems or processes that are maybe poorly designed.
Okay, let's unpack that a bit more. So, in a hospital, what does HFE actually look like day to day?
Well, at its core, HFE is basically a scientific field. It's focused on understanding how humans interact with their work environment and then optimizing that interaction.
Optimizing how?
In healthcare, it means designing everything. Think operating room layouts, the software on a screen, you name it, with human abilities, and importantly, human limitations front and center.
Right.
The big goals: boost safety, definitely, make things more efficient, and ultimately ensure patient care is the absolute best it can be.
So, if a machine is confusing to use.
Precisely. A poorly designed bit of kit can lead to mistakes. Doesn't matter how skilled the doctor or nurse is. HFE tries to catch those design flaws before they cause problems.
Gotcha. So it's looking beyond the individual mistake to the bigger picture, how the whole system might have contributed.
That's exactly it. HFE gives us a structured way to analyze that bigger picture. It looks at communication, are the channels clear?
Right.
Where could misunderstandings creep in? It looks at teamwork. How do different teams coordinate? Are there friction points? It even digs into the physical design. Can staff easily reach needed equipment? Is the lighting okay for detailed tasks?
Little things that add up.
Huge things, often. By analyzing all these factors, we can pinpoint potential weaknesses, failure points, and redesign things to be more robust, more resilient to inevitable human error.
Okay, this is where it gets really interesting for me. How does this HFE thinking actually lead to, real, tangible improvements in hospital quality?
Well, one huge application is in analyzing errors and near misses, instead of just logging an incident.
Right, ticking a box.
HFE gives you a framework to dig deep, to ask why it happened, not just what. Studies show that even really skilled people in complex situations can fall victim to biases, like confirmation bias.
Where you see what you expect to see.
Kind of, yeah.
Yeah.
You favor info that confirms your first thought. HFE helps design systems, sometimes called cognitive forcing functions, that nudge you away from those biases, making certain errors just less likely.
Oh. Building in safeguards against our own brains almost.
Yeah.
What are some other key applications?
Designing for usability, that's massive. Think about medical devices, electronic health records, even something seemingly basic like medication labels.
Oh yeah, EHR usability is a big topic.
It is. HFE Principles Guide, making those interfaces user-friendly, making workflows intuitive, making information clear. It's interesting, actually. Sometimes adding more features can actually make things worse.
Really? How so?
Cognitive overload, too much stuff on the screen, too many clicks. It can increase errors. Simplicity is often key. A great example is medication reconciliation. Making sure we have an accurate list of all a patient's meds as they move through the hospital. Super critical.
And prone to errors, I bet.
It can be. But using HFE, we can design the forms, the digital tools, to make it much easier for clinicians to gather and double-check that info. That directly cuts down medication errors.
So you're making it easier to do the right thing, almost designing the friction out of the correct path.
That's a great way to put it. And HFE also works heavily on improving communication and teamwork. It examines how info flows. Is it timely, complete, easily understood?
Crucial in a hospital setting.
Absolutely critical. By understanding those dynamics, HFE helps shape strategies for better handoffs, clearer communication, stronger collaboration between teams. It all builds towards a culture where safety is just ingrained.
Right, that safety culture idea.
Yeah.
And what about the patient in all this? How does HFE impact their actual experience?
Fundamentally, HFE aims to enhance patient-centered care. That means really considering the patient's needs, their preferences, even their abilities when designing how care is delivered.
Okay.
It also pushes for better communication between the patient and the provider, making sure you, as a patient, feel informed, feel heard, and are actually involved in decisions.
Can you give an example?
Sure. Think about discharge instructions. Are they just a dense block of text? Or are they clear, maybe with pictures, easy to understand and follow once you get home? HFE principles make a huge difference there.
That makes total sense. This sounds very holistic. Now, what about the staff? Hospitals are high pressure, workload is intense. Does HFE touch on that?
Oh, absolutely. Burnout is a huge issue, and HFE directly addresses the human element of the work itself.
Wow.
By optimizing work systems, making roles and responsibilities clearer, managing workload better, it can genuinely reduce staff burnout and improve job satisfaction. Our working memory, the mental space we use, it's limited.
Right.
HFE tries to design tasks and tools that don't overload that capacity, especially when time is critical. A less stressed, more engaged healthcare worker, they're generally more attentive, less likely to make errors, and just provide better care.
So, better work environment for staff, safer, better care for patients. It's directly linked.
Precisely. And one more thing. HFE is invaluable when implementing changes. Bringing in new tech, new protocols, it can be disruptive. HFE helps make sure those changes actually stick and integrate smoothly.
Right, change management.
Yeah. And underpinning all of this is what's called systems thinking. It's core to HFE, viewing the hospital not as isolated parts, but as this interconnected network.
So one change affects another.
Exactly. Instead of just looking at one medication error, systems thinking asks, what was the communication like? What was the nurse's workload? How were meds stored? It's about seeing the whole web.
That's a really powerful lens. Can you give us maybe a couple more concrete examples just to see HFE in action?
Sure. We touched on med reconciliation and EHRs. Think about surgical checklists, hugely driven by HFE principles.
Like the WHO checklist.
Exactly that one. Simple tool, right? But designed carefully with critical info, how to review it, they've demonstrably reduced errors and improved outcomes. That time out before incision, confirming patient, procedure, site, that's HFE saving lives.
Wow.
Or force functions, think of them as design that sort of forces the right action, like a car not starting unless it's in park.
Okay. Like a guardrail.
Kind of. In a hospital, maybe it's a system needing 2 nurses to sign off on a high-risk drug before it's dispensed, prevents single-person errors.
Got it.
And then back to the physical space ergonomics, designing workstations, like a charting station, or even how an operating table is set up, to reduce strain, prevent injuries for staff. That's pure HFE application. Improves comfort, efficiency, too.
These examples really do paint a clear picture, and it highlights why having some structure, some oversight, is probably key to making sure these things happen.
Absolutely. And that's where organizations like Joint Commission International, JCI, come in. They're major players globally in promoting quality and safety through really rigorous standards.
Right, the accreditation bodies.
Yeah. JCI's mission is all about enabling and affirming the highest standards. They work with, I think, over 1,000 programs in something like 70 countries.
Wow.
And their international patient safety goals, they directly target areas where HFE is super relevant. Think preventing falls, improving communication during patient handoffs, pushing hospitals to think this way.
And then closer to home for some listeners, perhaps, there's NABH in India.
Exactly. The National Accreditation Board for Hospitals and Healthcare Providers. It's part of the Quality Council of India. They do similar work, setting benchmarks, running accreditation programs specifically for India's health sector.
So JCI, NABH, their standards kind of nudge or even push hospitals towards incorporating these human factors ideas.
That's a good way to put it. Their accreditation processes often require systems that address communication, medication safety, safe environments, things that inherently involve human factors thinking. You hear testimonials from accredited hospitals saying the process itself improved teamwork, safety efforts, things HFE directly impacts.
So the standards provide a framework, a driver for adopting these principles.
Precisely. They help ensure these crucial considerations aren't just left to chance. It becomes part of the expected way of operating safely.
Okay, so if a hospital gets this, they see the value in HFE. Where do they actually go for heaven to implement it?
Yeah.
Are there resources?
Yes, definitely. There are specialized consultancies. Supremediq Consultancy Private Limited is one example. They partner with hospitals on everything from planning right through to getting accredited, like with NABH. Their expertise covers hospital operations, helping set up standard operating procedures, analyzing how resources are used, all places where HFE insights can make a big difference in efficiency and safety.
So they help bridge that gap between theory and practice.
Exactly. And then looking even broader, internationally, you have organizations like ISQA.
ISQA, the International Society for Quality in Healthcare.
Right.
What's their angle on this?
ISQA is this global, not-for-profit, member-based group. They've been around for over 30 years, really focused on promoting quality improvement worldwide.
How do they do that?
Through education, sharing knowledge, setting standards for external evaluation, building this global network across, again, over 70 countries. A big focus for them is person-centered care, which intrinsically involves understanding the human element.
Okay.
They provide resources, publish research, hold conferences, all aimed at building that global community around quality and safety.
Yeah.
And human factors is just a fundamental thread running through so much of that work.
So ISQA helps build the knowledge base, the community, globally. And HFE is a key part of that foundation.
Absolutely. And you see how it all connects. Individual hospital efforts using HFE, accreditation bodies setting standards, global groups like ISQA sharing knowledge. It all contributes to building a stronger culture of safety.
That phrase, again, culture of safety, we hear it a lot. How does actually doing HFE help build that culture?
Well, integrating HFE principles is pretty fundamental to it. When an organization designs its systems, acknowledging upfront that humans aren't perfect, that we will make mistakes sometimes, it creates an environment where staff feel safe reporting errors, reporting near misses, without automatically fearing blame.
Okay. That openness.
And openness is crucial for learning. It shifts the focus. Instead of just pointing fingers, you start asking, what in the system allowed this to happen? How can we fix the system?
Right. Supporting people, not setting them up to fail.
Exactly. It's about creating a system that plays to human strengths and mitigates our known limitations. It fosters trust.
That makes perfect sense. Designing for the reality of being human.
That's it in a nutshell.
This has been genuinely enlightening, a really important deep dive into something that affects healthcare quality and safety so profoundly. So if we were to boil it all down, what's the main thing you hope our listeners take away today?
I think the key thing is realizing that human factors engineering isn't just some, abstract idea or academic theory. It's practical. It's essential, really, if we want to make real, lasting improvements in hospital quality and patient safety. It means we have to think holistically: systems, processes, tech. How do they all interact with the people using them? Always remembering, basic human capabilities and limitations.
A really crucial perspective. Okay, on that note, here's a final thought for you, our listener, to maybe chew on.
Yeah.
As you think about healthcare settings, maybe your own experiences, or just imagine that complex hospital world, where do you see the biggest opportunities for this human factors lens to uncover ways to make things better? What seemingly small tweaks informed by how we think, how we talk, how we interact could actually spark a ripple effect, leading to safer, better care for everyone? Definitely something to think about. Thanks for joining us for this deep dive.